Healthcare without a conductor. Why risk management must lead the future to cut out the noise. Every musician is skilled, every instrument holds potential. But without a conductor, the music isn't harmonious, it's chaos. And healthcare is no different. Each team, each clinician, technology, the processes, they all have value. But without risk management leading, curating the tempo, cutting out the noise, and orchestrating alignment, we don't get harmony, we get chaos. A risk-based service design curates a better, safer system for the future. We all know the reality of our health and social care system today, where demand is surging, staff are overwhelmed, digital systems are outdated, and critical decisions are not being made strategically, and service level plans still do not exist which are future-proof. We don't allow clinicians the time to plan, and we don't train them to build services with this risk-based approach. And we're not failing people because we don't care. We are failing because risk management is not embedded in how we work. John Till is a household name in North Wales. John is most famously known for farming the rugged slopes of Snowdon. His face is mapped with the deep lines from years of battling the elements. He dedicated his life to North Wales, the farming community, and teaching the next generation to farm. But when he needed the healthcare system, it wasn't there for him. And John is what we now call a frequent flyer in our healthcare system. He suffers from farmer's lung, a condition that was inevitable after years of exposure to the elements. So once a very strong farmer, rugby player, now frequently collapses and is debilitated, gasping for air. One morning, after an exhausting night, he arrives in A&E. His oxygen levels are dangerously low to the point of unconsciousness. He has enormous, strong hands described as bunches of bananas, and he clasps his entire chest and cradles his head, gasping for air. He waits for 7 long hours waiting to be seen, only to discover that his chest x-ray was never ordered. So he's convinced staff are too busy and he drives home struggling to breathe. 2 days later, he returns worse and he's immediately admitted. He's told that he needs a full body CT scan. But again, it's never ordered. He asks, days pass, he asks again, and still nothing. John is my stepfather, and we've heard versions of this story before. We know the problem, yet it keeps happening. And this isn't just a failure of processes. It is a root cause of a much wider issue related to the failure to properly design a system fit for future demand. We will continue to see these issues and incidents with catastrophic events, but we must stop to redesign the service based on a risk-based approach. So healthcare is the most high-risk business in the world, yet risk management is not embedded into daily operations or as business as usual. Staff are not trained to design services based on risk. Instead of proactively managing risk, we react to it. And all too often, services still fail to plan at the local level. And we know the realities where demand is surging, our workforce is stretched to breaking point, our digital systems are outdated and inefficient, our resources are scarce and mismanaged. And yet, in spite of all of this, staff keep fighting to deliver care. But dedication alone is not enough. Without strategic planning, healthcare is like an orchestra without a conductor. Every musician is talented, every instrument holds potential, but without direction, all we get is noise. And this is why John was failed. His care wasn't mismanaged by individuals. Our patients are lost in a system that wasn't designed to function for the future risks that we face. And we know why people don't engage with risk, because it's boring, it's misunderstood, it's confusing, we don't have time to set aside the space. And the training out there is based on theory, it's not reality, so it's so hard to apply. However, we can simply look to the military. They scenario plan for every situation, every outcome, and they strategically plan their operations. They train frontline staff to manage risk independently and make risk-based decisions. They don't let soldiers run around the battlefield hoping for the best outcome without a plan in place or not knowing how to manage risk or the different scenarios. And we know the risks that we face. We can see what happens when we don't embed a risk-based plan. We see a 10-year waiting list for our children neurodevelopmental services, patients at risk of losing sight because ophthalmology equipment wasn't purchased in time, septic patients deteriorating in the waiting rooms when early treatment could have saved them, and we see our declining care home bed numbers. These are not unforeseen risks, they're known risks. But if we don't plan for the future, we face the risk of our children saying to us, "You knew this was coming and you did nothing about it." But because we fail to allow the right staff to plan, redesign the service, and provide better risk training, we risk incidents in our system worsening, and our population, our loved ones, deserve better care than being failed by us. So we must make risk management and strategic planning the backbone of our healthcare system and allow it to shape our services. So my ask is that every service manager is allowed to plan. They give their clinical teams the space, and they ensure risk management is not an afterthought, but a foundation for better decision making. This isn't about asking staff to work harder. This isn't about throwing more money at a broken system that hasn't worked before. We continue to patch up failures, but let's allow the space for strategic planning and embed risk management into every decision. And let's build a system that doesn't just survive, but it thrives. But we first must train everyone in the NHS and our public services in what good risk management is and how we apply it for safer, better, future-proof systems.